Thank you. Good afternoon and welcome, everyone. And thanks for coming to the Trauma Interest Work Group's Brown Bag session for this afternoon. I'm absolutely delighted to introduce our speaker for this afternoon, Julianna Stuart. She is the Vice President of Community Impact for the Preservation of Affordable Housing, also known as POAH. It's actually a national organization that focuses on affordable rental housing as a platform for resident success. And Julianna is the Vice President of Community Impact. In her work, Julianna leads strategy partnerships, fundraising, best practice developments, and scaling across POAH's portfolio. And she also manages POAH's strategies to help residents build assets, increase their earned income, and also achieve personal and financial goals. In addition, Julianna leads POAH's trauma-informed housing efforts to promote well-being and equity through design, property management, and resident services. As you know, through this series that we've had going on for the past couple of years for the Trauma Interest Work Group, we've tended to focus more on clinical activities, things that are going on that cross over areas that include the arts, violence recovery, et cetera. And so thinking about ways in which we can incorporate the housing sector as a part of what we consider as academicians in the Trauma Interest Work Group, I think is also very important. POAH is also a neighbor to the University of Chicago. Some of you may be aware of the Grove Park development that is between 61st and 63rd Street on Cottage Grove, and so they're very close to us just in terms of proximity to the University of Chicago campus. And in the effort of full disclosure, just want to let you know that I am a board member for POAH as well. So Julianna, with that introduction, why don't you go ahead and get started?
Thanks so much, Dr. Miller. And it's great to be here, and I appreciate the invitation to join this group. So while I load up my slides, I'll just share. So POAH we are a national organization. We have a really strong presence in Chicago. I'm actually based here in Boston, Massachusetts, where one of our major offices is. But I used to live briefly in Chicago and actually got my start in affordable housing on the West Side, not too far from the United Center. So great to connect with all of you. I will also say I have been doing a lot of presentations lately where they've asked me to cover my material in like 7 to 10 minutes. So I heard I have like 40 minutes, which is luxurious. I'm gonna take my time. Feel free to stop me at any point with questions. I don't actually think we'll take that whole time, but I'd love to engage as much as possible. So I'll try and keep an eye on the chat as well. Great. So I am going to talk a little bit about POAH. That was a fabulous introduction, Dorian. Just give you a sense a little bit about what our work is and what the work that my team in community impact does to kind of set us up for a little bit of a deeper conversation around the intersection of trauma and housing that we've been really exploring these last couple of years. And then I'll talk about how we kind of co-designed this model that we're calling trauma-informed housing. It's, built off of so much learning and research and practice in other sectors, but what does that look like in our space and how did we get there? And then I'll give you a taste of, through that design process, some prototypes really that we've been testing and some things that we've learned to really advance this model at POAH and hopefully in other parts of our industry. I'll talk a little bit about trauma-informed design, so specifically thinking about the built environment, and then how we're thinking about measuring impact. We are still relatively early on this journey, so we've been trying to have a kind of continuous learning process, but we see this as a long-term commitment, and so that will really be about kind of how we're framing impact and thinking about impact at this intersection. So a little bit about POAH. We are a national nonprofit, and our mission is to deliver homes that support economic security, racial equity, and access to opportunity for all. And we work in 11, soon to be 12 states. So you can see we have a strong presence in the Northeast and Midwest. a growing presence in the Mid-Atlantic and in Florida as well, which is where we try to talk our leadership into hosting all of our conferences is in Florida. But we haven't been too successful yet. So we own and operate 130 different properties. They're all different sizes. They're across the country. And so our communities are home to over 12,000 households, which is over 22,000 residents. We have a mix of family and senior tenancy housing. So some of our communities are just for folks who are 65 and older, and then some are unrestricted by age. And this is just kind of an interesting nugget to hold through the conversation. The average annual income of a POAH resident is $16,690. When you adjust that for just earned income, still only about $18,000 a year. So POAH is primarily delivering housing to very low and moderate income families. And just to give you a sense a little bit more about who we serve. So we serve a range of ages. We have communities where we serve a lot of children. Again, we have some communities that are restricted by age. And in terms of the racial distribution of our residents, you can see here 26% of our residents identify as white, 39% identify as Black, and then a mix of other identities as well. So again, just kind of to give you a sense of who we serve. So I'm going to talk a little bit about kind of our mission and what we do. And so our primary goal, as our name suggests, is to preserve affordability. So POAH got it started 20 odd years ago, really focusing on preserving at-risk affordable housing. We continue to do that, but our work has grown and expanded as the markets change, as the industry has evolved, we have as well. And we really build for the future, or we renovate and rehab for the future. So financial sustainability, environmental sustainability are all sort of part of the equation. So even when we think about the work my team does investing in residents, it's all within this bigger picture of sustainable housing ecosystem. Like any developer doing this work now requires a lot of creativity. You know, projects have 10 plus, 15 plus financing sources. It's really complex. And, you know, in the last couple of years with supply chain issues and rate increases, you know, this work only gets more complex. So creativity is definitely at the center of what we do. And as I'll talk a little bit about some of the work in Woodlawn and outside. I think increasingly being an owner that's trying to think about community level solutions, not just real estate development, but the role that plays in the broader community. And of course, investing in our residents, which we'll talk a little bit more about as well. So we are, you know, at our core, we're a real estate developer. I am not a real estate developer. So if you have any really sticky technical questions about that, I'll have to go get some feedback. But we do, you know, we do a range of development activity to increase the supply of affordable housing in the U.S. We also manage the properties that we own. So we largely own a property and manage it ourselves. And our management company includes over 450 frontline staff. They are a really important audience for us when we think about trauma-informed practice. So just worth noting that and kind of holding on to that. We do asset management. We're really committed to ensuring the properties that we own stay physically healthy, financially healthy for the long term. We have an in-house design and building performance team, which is exciting for a lot of reasons, but increasingly we are utilizing passive house standards. We do solar, we conserve water, we introduce features into existing buildings to make them more energy efficient. So good for the climate, good for residents' budgets. And this is a space where we're also trying to innovate around bringing more principles of trauma-informed design in. And then community impact is what we call the range of investments that we make in residents who live in our communities. And we really see housing as a platform for opportunity. We understand housing as a really important social determinant of health, but it can also connect to all these other social determinants as well, whether that's transportation, access to green space, access to preventative health care, financial services, really runs the gamut. So we'll talk a little bit more about that as well. So I just thought it might be nice to give a little bit of an example of development work, as Dr. Miller mentioned. In 2008, POAH was invited by residents of the former Grove Park apartments to come in and help revitalize and rebuild, but also retain all of the federal subsidy that was essential to keeping that community affordable. It was a contentious process in a lot of ways, but ultimately a partnership with residents of the community to revitalize the housing, introduce new commercial businesses, a mix of incomes, and also make sure that any resident who wanted to come back could. And so what we have today is Woodlawn Park, a mixed use, mixing community, a mix of residential, commercial, sustainable investments. And we also run what we call the Woodlawn Resource Center, which is a community center on Cottage Grove that has a range of services, both for POAH residents and for the surrounding community. So just a good example of where affordable housing development can really be integrated into the fabric of the neighborhood. So I want to talk a little bit about what we call community impact. So we know that housing is fundamental and that our need for housing is fundamental. Without it, we can't thrive, we can't grow. Access to housing, I think, is typically the kind of conversation, right? Like getting people access to affordable rental housing. It's such a big challenge. We need more of it. We need more supply, but that's only one part of the picture. And so we invest in ways that we think really utilize housing as a platform to help residents be successful beyond just the bricks and mortar. And part of that looks like providing services and supports that help residents, once they move in, maintain that housing and remain stably housed. There's a lot of barriers to stability that don't necessarily evaporate just because we were able to provide a roof and walls. The best examples of that, I think, really were amplified by the pandemic, right? So the ability to manage that monthly rent payment among all your other changing expenses, to get along with your neighbor, to comply with the housing inspection standards and housekeeping standards. And so a lot of what we do is maintain that housing and ensure that residents are able to stay stable. And on that platform, we feel like we can invest in all sorts of opportunities and increasingly in financial independence and economic mobility. But none of this happens without really intentional, really authentic community engagement, which is in large part where a lot of this trauma-informed housing work comes in. So these are just to give you a sense of the type of work we do, these are our focus areas. So in terms of creating opportunity, we hire and train staff who are embedded in our properties, and their role is primarily to be connectors to resources in the community. So we focus on these different areas to ensure that residents have access to preventative health care, that they are enrolled in insurance, that they have a PCP. We bring health workshops to our communities, whether it's a mobile van or specialists. So there's lots of different ways that housing can connect people to other resources. And this is kind of the basis for the community impact model that we have. It looks like throwing events. We do a lot of voter registration events. We'll talk a little bit about financial stability and employment. We do a lot of youth programming, a lot of out of school time programming. So just kind of, again, creating different opportunity for residents in our communities. And I just want to give a couple quick examples before we move into the trauma-informed piece, because I think it's an interesting connection between why we even have to think about this trauma-informed perspective sort of systemically. So increasingly, POAH is investing in economic mobility. These are two examples actually from Chicago. So when we were developing in Woodlawn Park, we were in conversation with the Jewel Osco that has come to the community. And so knowing that the grocery store is going to be coming to the community, the Woodlawn Resource Center spent years training residents to obtain the certifications that they would need to work in the meat department or in the bakery of the grocery store. So when the doors opened for hiring, we had hundreds of residents who had gone through our training programs who were able to get jobs at the Jewel Osco. On the right is Dawn Clark. She purchased a home after working with some of the financial and employment coaches at our center. They work on credit, We have access to different credit products. We have savings programs and that coaching that's really there to say, okay, what are your goals and how do we help you kind of map a plan to get there? So those are examples of some of the ways that we're investing in economic mobility. And one specific program I just want to call out, because I think it ties really well to how we think about this trauma-informed work as well, is we run a federal program through a very successful coaching-based model. It's called the Family Self-Sufficiency Program. So the majority of folks who enter this program and a number of folks who live in our communities want to be homeowners. They want to get ahead. They want to achieve that dream. But many of them feel they have too little income, or that their lack of or low credit score is holding them back. And so what this program essentially does is enable participants to work on that homeownership goal, work on building their credit while building savings. And it's really built off of addressing a disincentive that exists in affordable rental housing, which is that your rent is based on your income. It's designed to keep housing fair and affordable, but it ends up being a disincentive because when you work more and your income goes up, your rent goes up and other means tested benefits go down and the math doesn't pencil out. So it's really hard for families who want to get ahead to be able to do that. And I think it's also important to sort of just dispel that myth that folks who live in affordable housing do not want to work. That's not actually what we see. It's that these structural barriers are making it hard to do that. So when we invest in this program, residents are actually able to save when they pay that new higher rent, just like someone in a market rate apartment could when they get a raise. And so what we're seeing is that 97% of people who go through this program leave with that savings. They've had to increase their earnings in order to get it. So the vast majority of people want to work, want to get ahead, and they're leaving the program with close to $10,000 in savings. For context, they are making $10,000 when they enroll in the program. So their earnings are relatively very low. And so those savings relative to income is really impressive. I'm sort of lingering on FSS in part because it's a really good example of taking sort of this like structural issue baked into our housing system and thinking about it differently. And that I think is an appropriate bridge to how we're thinking about this trauma-informed work. Thinking beyond, we're thinking about the individual and the impact on the individual, but we're also thinking about the ways that our housing system structurally has created barriers or stripped people of opportunity or continues to sort of perpetuate these cycles where it's very difficult for people with low and moderate incomes to get ahead. And so I just wanted to offer that as we kind of transition into this conversation, which is sort of like around the connection of trauma and housing. So I know this group does not need any education about trauma, but I do want to offer like how we're thinking about it and defining it. So we worked for a couple of years with residents and frontline staff, really understanding this issue and how it comes up in their communities. And this is the definition of trauma that they encouraged us to use. And I just really appreciate that sort of takes it down to the level of the personal experience and just puts it in terminology that makes sense to the folks that we serve. But I also really love this definition from Resmaa Menakem and the work that he does, particularly around racialized trauma and the mind-body connection around trauma. But this idea that it's really a tool of safety and survival. And I think that is very much a part of how our housing system is designed, is for survival. Maintain housing at all costs, maintain your roof at all costs. And also that it's this response to the perception of something that's dangerous is also really important, because so often our housing system is really complex, it's very compliance heavy, it's very real estate heavy. And so we might perceive as housing practitioners that we're doing a good thing by providing housing and missing the way that like how we deliver it or how we manage it or all these rules and restrictions in the way that we deliver housing can be perceived as actually very dangerous or threatening or unstable to the folks that live in our community. So yes, I might have affordable housing now, but if I think that at any point I might get a notice from management that says I'm getting evicted, I might perceive it as very unstable. And so in our work that I'll talk a little bit about, our co-design work, I think we really had to appreciate the way that things that we perceive as adding value or being positive can actually be triggering, and in some cases cause trauma among the folks that we serve. So there was a really helpful ACEs graphic that we had been circulating for a long time, sort of visualized adverse childhood experiences, and we felt like we needed a way to show that in the housing context. So you know, we started this conversation thinking a lot about sort of the domain of trauma in personal childhood household experiences. Learning about ACEs was sort of how we got into trauma-informed care in the first place. But as we did all this community-based research and engagement with our residents, we really, I think, started to appreciate that we needed to zoom out and look at ways that the entire housing system is causing trauma. So housing that is poorly managed, unsafe, unsanitary, underfunded, can cause and trigger trauma among residents. Housing that's in climate vulnerable areas or and at risk of increasingly serious storms, located in a floodplain, like those are all forms of contributing to trauma. And then, you know, where housing is located, the ways the community is invested or underinvested in, how it's policed, how it's treated, the resources it has available to us. So the physical location of housing and its connection to the community. And then the reality that our entire housing system is built on, you know, historical decisions about who got housing, who got to become a homeowner based on the color of your skin or the neighborhood that you lived in. You know, this sort of meta question of why we need so much affordable housing in this country. It's not a coincidence as a result of systemic decisions about who gets it, who doesn't. And so when we zoom out and think about the role of trauma, we really felt like this all had to be a part of our lens. Again, we feel like we're doing this really good thing by building and preserving housing, but if we're doing it in a way that's actually creating other harm or stripping people of their power, are we really doing good? And I know there's, you know, SAMHSA's principles of trauma informed and lots of other principles out there. And after working with our residents and frontline staff, these are sort of the sets of principles that make sense to us to define what trauma informed housing is. So understanding that safety is fundamental on one end of the spectrum, but also understanding that centering beauty, centering joy are also essential to thinking about being trauma informed. So this is sort of how we define those principles. And this is a slide we use to train our staff that I just love to include. You know, it's sort of the same principles of trauma informed housing, right? Or trauma informed care. What happened to you, not what's wrong with you. I think one of the most truly transformative things for a housing organization is to think about valuing lived experience as expertise. And I'll talk a little bit about how we integrated that into our design process, but the housing system is very much one that values professional experience, compliance experience, you know, design and urban planning experience, and all those skills are really important, but very rarely is the housing system prioritizing the expertise of people who live and who work on the front line. And so we really wanted to kind of flip that. Like, how do we think about all the data that comes from those communities, not just from the experts who are doing this work at HUD or in an organization like POAH 1,000 miles away. So we are about 2.5 years into this journey of becoming a trauma-informed housing organization. We're not the first houser to do this work. We do think we might be the first to have coined this phrase, trauma-informed housing. And it's become a really big part of our mission, and it's something that we're really interested in expanding in the industry. So the process to get here was one that we wanted to kind of embody what it means to be trauma-informed in the entire process of figuring out how to become a trauma-informed organization. And so what we ended up doing is working with a group of partners and leaning into what we're calling co-design. I think others call human-centered design or design thinking, but just this idea that whomever you're designing for should be at the center of your design process. And we essentially followed a design process. So lots of discovery, lots of community-based research. I'll tell you a little bit how we did that. and then bringing the community together to make sense of the research. So what is all this data telling us? What does it mean? Are we hearing what you're hearing? And then bringing the community together to brainstorm and do ideation and imagine, like, what does a trauma-informed housing system look like? And then we went out and did some prototypes, and we're sort of in the process now of, one of our partners calls it pilot typing. So we're sort of piloting some things. We're still kind of prototyping some things with this idea of just like testing and learning rather than doing what we usually do in housing, which is like write a rule and push it out and we call it a day. So this process looks very linear, but of course, in reality, it's a lot, more complex. And we had to spend a lot of time doing learning. And we were doing this during a pandemic. So I'm going to give you a taste of what the process looked like step by step. And it was all over Zoom in the beginning. So first we brought these teams of residents and frontline staff together, which is very rare to have a team of residents and a team of frontline staff working hand in hand and going through a journey like this together. So they came together, they built community, and they defined what trauma-informed means to them. What's the language that they would use to talk about what it means to be trauma-informed in their community? And then that's the language that we wanted to use, particularly when we went out and did research. One of my favorites, we have a maintenance supervisor. So someone who thinks about maintaining the facility said being trauma-informed is about handling with care, which I always appreciated. So we took the teams through design exercises. So this is one example. They did a photo voice exercise. So they got a prompt: what makes you feel stable? What makes you feel joy? What makes you feel unstable? Or what makes you feel stress? And then they went out and took photos in response to the prompts and captioned them. And so it really brought out a lot of rich insight around like what people value about their home. And what are the things that we might be overlooking that are some of the things that are really obvious that give stress. This was someone shared a broken window in their bedroom is really stressful. But it was also things like when there's too much trash outside and it feels cluttered, or our staff showing pictures of their desks and saying, I have too much to do and it makes me feel overwhelmed. So going through different kind of creative exercises to draw out insight from the community, like what does it mean in this space to support joy? What does it mean to draw out further stress? So then the teams learn how to do community participatory research. So they design interview guides, really just trying to learn how housing can avoid triggering or re-traumatizing people who've experienced trauma. So they wrote interview guides, they put it in their language, and they went out and interviewed their neighbors. Again, residents interviewing staff interviewing residents. And then they brought all of that data back to their team and we made sense of it as a team. And then we moved into brainstorming and imagining like, how do we want to respond? How do you want to see POAH respond? How do you want to lead a response to all the things that we learned and heard? And I love this screenshot of a chat from once we switched to brainstorming, as one of the participants said, trauma impacts executive functioning and can make it really hard to be creative and to problem solve and to think about the future. And so even just going through this exercise of trying to design spaces where residents could get really creative about the future with no limits, no boundaries, just big picture brainstorming and thinking about how to do that in the midst of a pandemic when people are very stressed and living through a lot of trauma, and do that using different types of creativity, I think was a real challenge and a real opportunity to sort of practice transforming our housing system into one where new ideas are embraced rather than just sort of accepting how things are. And then finally, we got to be in person. So by the beginning of 2022, we were able to bring our community members together. So we had 4 different teams. They were communities across the country to come together, and we put them in a prototyping workshop. Again, like a property manager, so someone who's responsible for all the rules and policies in a community, with a resident getting together and saying like, how could we change the rules? How could we imagine, a different way of connecting with each other instead of such an adversarial way? So it's just a really powerful experience of thinking about the relationship that frontline staff have with the residents in our communities and the opportunities that they very rarely get to imagine what the future could look like. So that's a taste of our process that we wanted to sort of like embody trauma-informed practice in the process of becoming a trauma-informed organization. I just want to give you a couple examples of what we learned. So first, these were 4 really diverse communities across the country. So we had folks who live in urban, suburban, rural settings, living in an apartment that's scattered across the city where POAH owns buildings all over the place. I mean, in a building that's a huge campus where everyone is on one large piece of land, like just very different contexts, but there were a lot of really cross-cutting themes. And so what they basically told us is these are the things you should think about when you want to become a trauma-informed housing organization. This is what POAH should focus on. This is what it would look like for our housing to be more trauma-informed. And I'll just call out a couple. I think one of the big ones that, tends to sort of get put in this like services, case management, fuzzy, warm bucket is the idea of encouraging community care. But it's really about like, how do you look for existing or organic communities of support that people lean on to get through difficult times? And so often we kind of turn those organic communities into something transactional. So there's sort of this one-way relationship between resident as client and staff as service providers, rather than saying, how can the housing organization support and lift up how residents already provide care to one another? Or how can we think about creating communities of support for frontline staff who often feel very isolated or feeling really burnt out, and not rely so much on this sort of hierarchical relationship. So that was a really powerful one. I think the other one was just the idea of redefining leadership. So residents who live in affordable housing communities and staff who work on the front lines very rarely have power over decisions that impact them. They are not usually writing the rules, they're not writing the policies, and often they feel like their power is constantly just being stripped from them, even though they have a lot of expertise and they have a lot of skills and valuable perspectives. How do we flip that relationship so that they have more power? And the last one I'll mention is this idea of communicating with dignity and belonging. I think a really big theme was that structurally and relationally, the housing system is constantly sending messages to residents that they're not to be trusted, that there is a years-long waiting list of people who could replace them if they slip up, which frankly is true, right? We don't have enough housing to meet the demand. So you've got these enormous wait lists and sort of feeling among staff that like, well, if this resident left, I could easily, replace them with someone off the wait list who also needs housing. And this perception among residents that like, I just have to do everything I can to hold on to my housing. I can't think about the future. I can't think of other things because this resource is so scarce. So again, just like themes that we learned through this research, like what it means to become a more trauma-informed organization is recognizing these things and integrating them into how we work. And so for a housing organization, that looks like looking at different parts of our business. And we learned a lot from health systems as we were looking at trauma-informed care, thinking about how to adapt that to the housing system means that the process by which we develop housing, so buying it, building it, renovating it, is the first place that we should think about integrating trauma-informed practice, designing more trauma-informed spaces, residents having power over the decisions and having power and influence over the decisions that get made when a developer comes in to rebuild. How we manage day-to-day, like I said, policies, procedures, I'll give some examples of that. How we deliver services, and then how we invest in human capital. So how we think about being an organization that values and centers frontline staff so that they can turn around and deliver that to residents as well, and recognizing that relationship between them. So I'm going to give you some examples of the pilots that we worked on. So these are the ideas that our community surfaced as important to them, and going through this design process, we sort of said, okay, here's what we're hearing. Here's the root behind it. Here's the assumption behind it. Let's test that assumption. So the first one was a pilot that we called Residents Lead. And it was just responding to this idea of redefining leadership, that residents very, very rarely have choice and power. And so the idea was to kind of create this advocacy group of residents. They would go to the state house and they would change housing policy. But we realized we needed to understand first, do residents feel like they have power at home? Do they feel like their voices actually matter and are heard at home? And so the prototype that we tested was like, let's have a pop-up feedback session on a decision that's about to be made in this community. In this case, it was renovating a basketball court. And let's see if residents come out, let's see if they give feedback, and let's see how they feel about this process of informing the decision. And then as a result, I'll just mention we've launched a lot of new resident leadership opportunities. We have a new advisory board. We're looking at ways that residents can be involved in state advocacy. And we're also thinking about training our staff to do more of these sort of like activations in their community. So here the residents are coming out to the pop-up feedback event. And people came out that the staff had never seen before, and they learned that the location of this basketball court was really meaningful to the community's history. It was very iconic. It was very important. So even though the staff felt like it needs to be updated and we should move it to a better location, they said, wow, I didn't realize this mattered so much to this community. We thought it was just a basketball court. So just sort of like this, testing this assumption that yes, people want to engage about things that matter to them, and that we shouldn't overlook something as simple as like, where is the basketball court located? The basketball court is a really important community asset. And then on the right, we also launched an advisory board, which has been a really awesome experience for us as a national organization. What does it look like to have residents coming to the table with our CEO and giving their feedback and asking questions, and also hearing from people who live in other parts of the country, and then watching us follow up on that. So examples of how we're thinking about residents leading, both small scale and also these like longer term pilots. So one of our teams really wanted to focus on staff well-being. The staff wanted to focus on taking care of other staff. We're in the midst of the pandemic. People are feeling really burnt out. There's a lot of disconnection. Our staff are still reporting to their work sites while many of the supervisors are in different locations. So the challenge was this feeling of burnout and overwhelm. And their idea was, oh, let's have a mental health day. Let's do nice activities for staff at work, which they tested. It was a very luxurious wellness day. But what they learned in the process was, yeah, this is nice, but it's not getting at root cause. Root cause is that I need my supervisor to value my perspective on things. Root cause is that I need to feel like leadership is listening to me and is responding to my ideas. And so it was a really great example of where we were sort of testing this assumption, like, let's add this nice thing to frontline staff's day. And instead learning, well, that's not actually addressing that's a symptom. It's not actually addressing the thing that needs to change. And so over time, we started thinking about new ways to really kind of activate that supervisor-supervisee relationship. We're creating new peer support opportunities for for staff to connect with one another. And then we added new benefits, adding personal time, looking at testing flexible schedules. So thinking about those different layers of support and the relationship that staff have and the power they have with their supervisor, rather than just saying, let's add nice things on top. And then the last one I love to offer, because it's a little bit of a wild card here, but one of the issues that one of the communities wanted to address was the fact that you cannot consume cannabis where it is legal. You still cannot consume it on federally assisted property. So that means if you live in Boston, where it is legal and prevalent, and you receive federal rental assistance, you are not allowed to consume cannabis in your home. In Boston, the majority of our residents identify as Black. In Boston, the majority of people criminalized for using or selling marijuana were also Black. And so this community really wanted to flip this and say, like, this is a traumatic issue. This is a trauma that our community lived through, and we are still being prevented from not only consuming, but benefiting from the monetization and legalization of cannabis. And so that was the conversation. But what was interesting is that over time they said, well, we have this amazing idea about how we're going to see this differently. We want to have community education. We want to have a farmer's market and a greenhouse and classes about mental wellness. Cannabis is a part of it. We want to change the policy, but it'd be this bigger idea. And so it sort of took them in a direction of talking more about the relationship between the mind and the body. And they realized like that's really that's also a part of this idea. So before we can build this whole wellness program and change all these policies, like we actually need to understand if this connection matters to people and if they want to have it supported by management. So it was an interesting change the community drove. They said, we care about this issue, but we really want to focus on mind-body connection first because we want to be well. And it sort of pivoted the approach of the pilot. And so what ended up taking shape was resident-led mindfulness classes. We worked with a trauma-informed yoga instructor. We brought a lot of mind-body wellness into the community, which was very different than how the sort of services team usually approaches services. It's like, let's bring a Zumba instructor in, or we'll do a health workshop, but we're not really thinking about like spirit and body together. And I think that was really interesting and a really great learning and something that's been integrated into a lot of other practices. So, they open their community room to do these meditation classes, which is the photo on the right. But we also, we were integrating things like breathing exercises and centering practices into our meetings. That was new. That was very rare. People really had a chance to slow down. So integrating some of that into our meetings. Like I said, we launched a trauma-informed fitness program pilot, which was really cool in another communities. Like, what is it like to have choice over your health journey? And then we offer a lot of mindfulness programming for staff as well. So even this conversation about mindfulness is not common in our world in particular. The idea is sort of like you show up, you do your job, you work hard and you get it done. But this idea of having support to kind of build that connection, I think was really driven by the community. So I'm gonna actually skip ahead a little bit. These are some of our own internal lessons. But I want to just draw attention to this toolkit that we released. And so essentially what we did with all of our learning is say, okay, what are the sort of universal replicable things from these prototypes that we want to integrate into our work? And so we created guidelines for each of those areas I showed before. So these are guidelines for how we write policies going forward. And we're in the process of rewriting all of our property management policies. And so this idea of like creating slack rather than what is typically the norm in housing. You have a lot of rules and they have very tight timelines. And if you don't bring your information in within that tight timeline, you're at risk of getting a violation, and those things can stack up and really ultimately threaten your stability. Just this idea of communicating positively over punitively is so simple, but really, really, really big in housing. A lot of time the message is, here's all the things that you can't do. It's a risk management perspective, right? It's okay, we have real estate, protect the asset, risk management. And really this idea that we need to start flipping things to center the people first, not the real estate, not the compliance. And so all of that is integrated into this toolkit that we released, which also has some training tools for other housers, agendas, and all the activities that we went through to design this, and then physical design tips and some of the case studies I just shared. And so the last thing I'll touch on is our trauma-informed design practice. So this is a really exciting approach, I think, to architecture and interior design that's picked up speed a lot in the last few years. So we really wanted to figure out, like, what does that look like in the typical POAH community? And so this is sort of this just chart showing you there are all these design opportunities that map to each of our principles. Like wayfinding. Can I enter the building and know exactly where I'm supposed to go? Is that clear? Or do I not know what's going to kind of come around the corner? Sight lines, privacy, acoustics, all things that are super, super important. And so we created a lot of different guides and tools for POAH and for other housers to think about how we design affordable housing differently. So, this do's and don'ts guide is an example of like how we would typically on the right design a building in affordable housing. You've got one way in, one way out, one source of light, very limited privacy to the adjoining buildings. And on the left is like what we should be designing and what we are increasingly designing now. There's multiple points of entry. There's multiple sources of light. There's amenities. There's different plantings. There's some offset privacy for the adjoining building. And a lot of times people say, well, that just looks like good design. And it is good design, but it's also design that's informed by the community. So how residents are involved in shaping the design of their community is increasingly important to how we build and what we build in affordable housing. And I'll show another example. So this is one of the communities where we work, and even things like adequate privacy with the ability to screen, or natural looking materials rather than sort of stale office materials, layered lighting. These are all, again, good design features, but they're also trauma-informed features that sort of recognize how stimuli, how we respond to different stimuli, or how our bodies might experience the space. And this is an exterior version of the same community, exterior photo of the same community, different social spaces that we can activate, and different sight lines within the courtyard, and also just the fact that, you know, this looks like a market rate apartment building, right? This looks like the quality of housing supply that we all deserve, and it's affordable. These are some interior photos from a project we did for formerly homeless veterans, and so knowing that they would be coming with essentially nothing. I mean, some of the veterans that moved in like showed up with one bag, and we worked with a team of designers to furnish their apartments for them. And so, you know, these features, like using different kinds of screening to create some privacy but still having clear sight lines. Using different acoustics treatments was a really big theme that we heard. Whether I'm in my apartment and I can hear what's happening next door, or I'm in the office renewing my lease and providing a lot of personal information, and I can hear what's happening in the next room, makes me not want to provide that information to you. So thinking about acoustics as sort of a design feature, but also kind of a programmatic feature. Again, like layered lighting, soft textures and materials, natural looking materials. So just examples of doing that in the physical space. And then lastly, you know, we're early on this journey. We are measuring impact. We are leaning on the evidence that exists in other sectors. But ultimately, our goal is that if we integrate trauma-informed practice throughout our work, it'll have a positive impact on residents, on frontline staff, and the sector as a whole. And so we really think that it's a way of doing housing that it's sort of the how we do housing that will ultimately be good for everyone. And to measure that, we are working with the Urban Institute on an evaluation. We designed a survey, and we're really leaning on some of this learning from their Partnership for Mobility from Poverty, that recognizes that like the economic success, so all those investments I talked about in job training or home ownership or financial coaching are important, but they're one leg of the stool. And so in order for those things to help families be successful, we also need to feel that we have power and autonomy in our lives and that we're valued in our community. We really feel like that's where the trauma-informed housing model comes in. If we can build that sense of agency back up, if we can help people feel like they belong because we communicate with dignity and belonging, then all those other investments that get made in the built environment and in the services will be successful. So our evaluation is looking at sense of agency, it's looking at sense of belonging, relationships with staff and residents, awareness of trauma, and also expectations for the future. So how long do you expect to live in this community is sort of an indicator for how much folks feel like they belong. And then the last piece around mindset, around measurement, is thinking a little differently. I think, you know, we really rely, especially in our industry, on quantitative evaluation, but how we think about social change using changes in mindsets and actions that ultimately drive changes in conditions. And so for the teams that we worked with on those prototypes and all that community-based learning, they defined outcomes that they wanted to measure. And so these are examples of the outcomes that they wanted to measure. Again, mindsets, actions that will ultimately drive a change in conditions. And that's not usually how we define success in our housing system, but it's so important to really activating this trauma-informed approach. So I love this first one. We see our value and strength beyond transaction of money or services. That's not typically the relationship a renter has with their landlord. But how can the housing system show value beyond that? We value feedback as an opportunity for growth rather than a critique on our self-worth. That allows us to take risks, to try new things, to be open to failure, to be open to taking advantage of all these other programs and services. So I think part of this trauma-informed housing model is also sort of shifting how we think about measuring outcomes and how we think about measuring success. Yes, we want the quantitative stuff. We want to know if residents are remaining in their homes, if they're taking advantage of all of our great programs, but we also want to know if their mindsets and their actions and our staff's mindsets and actions are changing. And we feel like that will ultimately lead to that change in conditions that will make our housing system more equitable. So I'll stop there and drop the slides. So great. So happy to take any questions if folks have them.
Thanks so much, Juliana. That was a really great presentation. And very happy to have the opportunity to be a member of the POAH board. Brad, do you want to start off?
Sure. Thanks. Thanks for a great talk, Juliana. Really great to hear how this is being driven by the people who live there, wherever it is. I know you're in Boston, but since you're familiar with Chicago and you have this site in Woodlawn, I was wondering if you could comment on the relationship between the university and the surrounding neighborhood and how that has affected your work as an organization and the lives of the people that you house.
Yeah, Brad, that's a really good question. And I hesitate because I have a colleague that Dr. Miller knows that is very equipped to answer that question. And I should have asked her that before. I think we've had a really positive relationship in a lot of ways. And I'm curious, Dr. Miller, if you have any insight on that one from your experience being more local.
So I've had the opportunity to give talks at the Resource Center around health-related issues, and primarily seniors have come in order to listen to the talks, and so it's been pretty positive. I care for patients at the University of Chicago who are POAH residents, and they've been, I think, fairly pleased with the changes that have taken place in terms of the Woodlawn group in comparison to the housing that existed there previously in Grove Park. I sometimes think that the residents would like to have perhaps a closer relationship with UChicago Medicine. I know that there's a presence of Friend Family Health Center there on Cottage Grove, which has been seen as a positive, but I think that it's more along the lines of, yes, we're neighbors, but we're not necessarily passing sugar and eggs across the fence, if you will. So that's probably the best analogy that I have for it. But for the most part, I think the relations are positive.
Thanks, Dorian. I guess a follow-up to that for you and Juliana. What are some things that you would like to see the university doing with the community in Woodlawn that aren't happening now?
Leave that to Juliana, and I wish that Felicia was on the line because I'm
Yeah.
sure you would have a lot of thoughts about how that might take place.
Yeah. No, I appreciate that. I think we have had a really positive relationship so far, and I'm cautious about that question, Brad, but I'd be happy to follow up after. Before I came to POAH, I actually worked at my alma mater around campus community partnership and ran a program for students to be embedded in community-based organizations. And I think that being on the organization side, those things are really helpful from the perspective of like, come to learn, come to listen, come to be open to understanding how things, how things work around here and really trying to understand the issues. So I think there's a lot of potential. And I think that across our portfolio, we want to be a neighbor and are constantly learning more about what that means to be a good neighbor as an institution. The people who do the deals are not the people who end up managing the community day in and day out. And so, I think there's probably a lot of opportunity for our staff at the Woodlawn Resource Center to like learn more about the ways the university is trying to connect with the community as well. But I'm sure that others that I work with locally would have some interesting perspective on like demographic shifts or housing shifts as a result of some of the activity. I think at a minimum though, like going to the businesses like on Cottage Grove that were brought into the community and spending money there and using the L there and, being active members of the community in terms of like the student population and the surrounding population, I think would be great things. So I regret that my colleague isn't here who does this work every day in Chicago, but I'd be happy to follow up with Dr. Miller and share any of those thoughts after the call.
Have lunch at Daly's. It's one of the oldest restaurants in the city of Chicago. So that's at least a part of it. And that was part of the rebuild that took place. Someone here that's locally, if Bill Eager also was on the line, I think that he would also have some, and because he's part of POAH Chicago. I have a comment, more of a comment. And I think that one of the things that strikes me about this work is the way that you've woven in equity without calling it out. Just in terms of the engagement, the agency, all of the things that come into play there, which I think is something that's very unusual for renters who are not in a co-op type of model to have within an organization. So kudos to POAH for putting, I think, weaving this into this particular model.
Yeah, thanks. Yeah, there's a lot more there.
Yeah. Other questions or comments for Julianna? We've got about 2 minutes left before we need to close. James?
Hi, Julianna. Thank you so much for sharing. I actually used to live in the Woodlawn Gardens, right where June is, and I'm delighted by the work that's been done. I would also be interested in what the residents and, what better relationship looks like to the residents. And so I'm happy to, continue to learn with Dr. Miller and Felicia. I don't know if I know Felicia, but I'm happy to learn more about that because it's near and dear to my heart. So I just want to thank you for sharing. And I agree with Dr. Miller's comments. I think you guys have woven in things that are really tangible, that kind of share power, which is really at the crux of creating more equitable communities and society. So thank you very much.
Awesome. Yeah. I'll definitely make sure we share some of that back. And I would mention too, I think I didn't bring it up, but throughout this whole process, anything that residents did where they were offering perspective, they were compensated. And I think that's an important part of the picture too. So like, to the extent that further work is done by the university, think about how we can build relationship, like really meaningfully compensated too, for time and for that expertise. So that was a big learning for us that our partners said up front. They're like, we love what you're doing, but we won't work with you unless you're going to compensate people for participating in an interview, being on a focus group, being a fellow in the project. And that I think is something we had to develop some organizational competence around that we didn't have before.
Yeah,
Exactly.
Thanks for your comment, James, in terms of sharing power and resources. Julianna, for people who might want to talk to you offline, if you could drop your email into the chat, that would be terrific. Felicia is Felicia Dawson, who's a vice president for POAH Communities, if you're interested in having a connection with her. And she's actually based here in Chicago. Although she's part of the national organization. So that's it. And Felicia's POAH Communities email is in the chat as well. Are there any other questions or comments before we adjourn? Great. Again, thank you so much. This is a great talk, and I think it's given our group a lot of opportunities to think about the ways in which we can expand our vision around trauma by including housing and the perspectives of our neighbors within that setting. So thanks again, everybody.
Thanks
Yeah,
so
thank
much.
you. Thank you
Bye.
so much, Julian.
Yep.